Hello, welcome to Aware and Care, your weekly prescription with Dr. Ambika Nair, co-founder and chief consultant at Santhigram Group of Companies, a series that we have built over the time to give you information about alternative medicine and healing through home remedies and Ayurveda. And Ayurveda has been an ancient science, which we are very much aware today, also through programs like Aware and Care. In the series on dystonia, a very painful condition, last week which we started, we're going to continue that today with a different aspect of it. Let's first welcome Dr. Ambika Nair. Namaskaram, Doctor.
Namaskaram.
Dr. Nair, dystonia, it's a very painful condition. Last week we spoke about dystonia of the neck.
Okay.
Now something very close to the neck is the vocal cords. And everybody is talking too much on the phone and communicating with each other. People are singers, speakers. Are these the only people who are affected by this condition, vocal cord dystonia or laryngeal dystonia? What does this actually mean, and what are the symptoms?
Actually, first itself, people they don't understand what is dystonia and all. They will only feel that there is some scratch, little difficulty in speaking, the voice, what they want to use, especially, experience with the public speakers and the singers, and even the professors when they take class, because their voice may not come. They can, the children, the students will be seeing, they will tell, they will try to correct the teacher that your breathing is coming, little trembling, tremor is there when you, the proper voice does not exhibit. Okay. So, little scratch will be there. Then in slight pain can be there, little headache can be there, little difficulty in swallowing. So, you get a throat infection, but it stays for a few days, maybe 8 days, 10 days. After a few days, again, the repetitive a throat infection, which is affecting your voice.
It is affecting the voice.
And the vocal cord, you can't,
So, is it seasonal or it just comes only to people who use their vocal cords more? Anybody can be affected with this. Screaming at somebody.
Anybody can get affected actually, because it's not some days it can be, after the surgeries also, any surgery in the, thyroid children, people. Any surgery is done, any nodule removal. Some days it happens. Some injury also can cause it. Not only with the surgery. And, smokers. And even in some cancer patients and all, we have seen that. Yeah.
So how is this different from when somebody is actually screaming a lot or, yelling, and then your voice is held up for few hours or days. The next day you feel a little sore. That and this is completely different, or that is temporary dystonia, or this is
that will be temporary dystonia actually. That is not a dystonia because their voice is there. Only that's why they are screaming on their top voice. Especially you can see in the politicians, when they speak, there is no control.
Okay. So in this dystonia, laryngeal dystonia, or much more easier for our viewers to understand vocal cord dystonia, is it completely connected to the ENT, or it's only connected to the ear and the voice?
ENT, it is ENT only, upper respiratory. Yeah, so it will be connected to that only, throat.
Any kind of allergies that can aggravate this condition? Is it painful?
Yeah, or is it kapha people, kapha. So aggravated kapha, if the, allergies like a sinusitis, post-nasal dripping, if you don't take care, any infection in your ear also, nasopharyngeal congestion or anything like that, it will affect actually. So in this condition, the nose block will be there. So these all can be taken care once you really. I'll be coming to that point. Okay, so yeah, that's therapy. What they need to do.
Okay. Any other symptom or thing? Any age group of people, or it can affect any age group or any specific gender that it comes that you have noticed? And what kind of patients are you now treating?
Yeah, normally 30 to 50-year-old we have seen like that. Okay, see one thing already you told, that is screaming. Unnecessarily irritating, continuously speaking, and not giving any rest to your throat. This all contribute. It's all contributory factors. But if it is coming like a repetitive for a long time, and even after taking antibiotics and all, not getting the right, improvement, then you should always go to the doctor and say that you have to rule out
Right.
What is the real diagnosis?
Okay, so somebody who's speaking for many hours can also get temporary dystonia, like you said, and otherwise there is a condition. And how long term is it? Is it life threatening? Can somebody actually lose their voice because of this condition?
No, it can be some focal. Sometimes only the muscles will be getting affected a little bit. You understand? And if you don't talk for some time, it will restore back.
Okay, good.
Yeah, don't be afraid.
I'm so concerned today because I was mentioning the last night also in some of my programs that I've been speaking non-stop for 12 hours and I've seen a change in my voice. I mean, over the years, people have changed in voices also, and though not being singers or any other too much of a public speaker, we all have seen that change. So we are really concerned. Now, there was also a question about, vocal cord dystonia. Does it lead to cancer, or cancer also leads to this? Is it related somewhere? How do people get checked?
Related, some tumor or anything like that. Sometimes it can, Yeah.
And what about the phlegm? Sometimes somebody feels that something
that is the post-nasal dripping. You understand? No? That is the, in sinusitis, when you don't, like heaviness will be there and stiffness will be there. Neck stiffness can be there. Fogginess can be there. Your focus will not be there. You get, like mentally irritated when you cannot do this. Your mind will be telling you to do, but your body is not allowing you to do. Then that leads to depression. In anxiety, people also, want to finish everything. That's too much of training, that itself, that you should understand that, that something is wrong on your throat and the larynx. Yeah.
Dr. Nair, whenever you talk about certain symptoms, I'm sure even our viewers, me also, I'm going tick, 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 tick. I have to rush to you immediately. Any kind of spasms that you want to mention here before we go to the treatment process?
Yeah, because
the neck or anything happens because of this condition, or people are like constantly going kitch, 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 kitch?
like there are, see, this all, affects the muscles that draw vocal cords apart. Even the abductor and adductor, is characterized by, that breathing, like a whispered speech, loss of voice. Some people, they used to speak in high pitch. Now they speak very, very like muttering. So these all, they cannot control their speech, they cannot take care of the speech. Some affected individuals, they when they, they have to put a lot of effort to speak like that. That spasm comes.
The spasm comes there. Okay.
You see some patients, when you ask them, they struggle to talk to you like that. Okay? So we understand there's an issue. Yeah.
So it's shortness of breath is there. They're struggling to speak.
Voice difficult. What they speak, we cannot even understand. Even in Parkinson patients, because it affects their, the tongue also like that. So it affects them a lot, actually. Yeah.
Interesting. And today we're talking about laryngeal.
See, 15% of the patients, because they improve, it is related with the neck and, tongue. But, in larynx. Okay, so some people, if they don't take care, what they eat, everything, matters a lot, actually.
So friends, in this episode, when we're talking about laryngeal dystonia, I know that we are in current times where we're looking at symptoms for only the pandemic related thing or flu related thing. Some symptoms are correlated to each other. Some symptoms are independent of its own diagnosis. So do not self-analyze in Google and get some medications and try to work on it. These are specific conditions that we are talking, dystonia series, where last week we spoke about the neck. Today we are talking about the vocal cords, where there's a lot of discomfort. Now let's come to the most important aspect that we want to know. How is this treated at Santhigram?
Okay, when they come for the consultation, we see their pulse and we will be able to understand what type it is, whether it is Vata. Vata is also affected and Kapha also will be affected actually. Okay. Then, whether they have any genetic factor, their history, we have to take it. Whether they suffer from any thyroid, any tumor, any surgery was done, anything. Then, diet comes according to the constitution. So we will be stopping their milk and milk products. And, mucus, giving food like banana, grapes, smoothies, all those things will stop it.
Okay.
And really milk, we will stop it. Yeah.
Okay. So this is part of basically just the initial part of understanding what actually is causing it.
Then
and just
Panchakarma will be given to them according to the condition of the person. So Nasam is done. And Dhumapanam. There are, like we have like a very Ayurveda, the oil and all for mouth gargling. Tadisapatradi, Vyoshadi Badagam. It all depends upon the condition. Please don't go and buy everything like that because they will tell that. Okay.
Yeah. And there must be different categories of this because it could just be a sore throat, it could just be, flu related or cold related thing, or it could actually
that all will be different, because this they will go to every doctor, then only they come to Ayurveda. So don't worry. Especially, like I have to, like just now I have like 3 cases. They are singers only. Musicians. So they cannot, like perform now. So they are, so recently only like one came, two others, they are doing much better now. Much better in the sense they are already performing their, like a profession. Yeah.
Okay. That's good. So this is symptoms and some treatment options, how it is diagnosed at the center that we have spoken about. Now, I'm sure some of you want to try some home remedies, which you can just pick it up like that. Again, a statutory warning there. Please do not try the home remedies as it is. There has to be a diagnosis. And after that, these things, if it's snowing very hard or there's a storm where you're not able to travel or something, that's when you should try certain home remedies, which are prescribed under the doctor's guidance.
Tulsi,
so, doctor, what kind
Tulsi leaves are very good. Tulsi, honey, and turmeric.
Okay, and you just take
very nice. And do gargle with the turmeric and salt, warm water every day. You can see a big change in you actually. And if you do the oil pulling also, that will help a lot. And avoid whatever food which is not suiting you. Don't overeat.
So when you mentioned about oil pulling, I do want to just reference back to one question one of the viewers was asking, that do we do it for a week and discontinue and then start? Is it okay, or it was just all the effects discontinue the moment we stop? When you do oil
no. If you really want your, like you don't want to go to the dentist, excuse me for that, okay? So oil pulling is really good for your gums. No teeth diseases will be there. And no cavities will be formed. It's an amazing, treatment in Ayurveda.
True. And during the pandemic, the one place that we are so scared to go now is at the dentist office. With due respect, because you're so exposed there. But whatever is required to take care, whether you're dental cleaning or other aspects, please go ahead and do that. And we're talking about laryngeal dystonia, that is vocal cords dystonia, and doctors is just giving us some information about some home remedies that could soothe us and reduce the discomfort of dystonia. Dr. Nair, what kind of foods are more helping to help the vocal cords or the throat?
Ginger.
Ginger in foods or ginger water?
Ginger water. Not ginger in the food is good, but not so much. Like the ginger water, we always tell them. Coriander, cumin, and fennel seeds, same amount. They can boil it and take it with honey. It helps a lot. Gargling with salt every day, morning and evening. Brushing your teeth twice. And try not to take, when you have a problem like this, like very cold water, very hot water, tamarind, all those things, like we don't, like pungent things, we don't give them.
Okay. Now, Dr. Nair, I was just thinking about a thought that vocal cords and throat infection, they are completely different or related.
It is there only in the larynx. No, laryngitis only, if it is a chronic laryngitis only, will lead to all those things.
Lead to.
Yeah, so this can be like that only. So if you take care of your mouth, this is the oral, like a oral cavity, you have to take care. Oral hygiene is more important actually. Brushing your teeth.
Dr. Nair, yeah. You mentioned that there was a couple of people, some patients who are with you who are into singing or you are using their vocal cords more.
Music teachers, they are music teachers.
No. So what happens during this treatment process? Are they required to keep their vocal cords at rest or they can continue to do?
No, that only because they came, they have taken antibiotics and all, they have taken so many other, whatever they could take. Then only they came to me. And, after 2 weeks of treatment, they are able to speak. They were unable to speak even. because it was like a voice was not coming out in the proper way.
Okay.
So now, like they are able to speak. They are able to sing, actually, not speak.
And is this condition contagious?
It's not contagious, but throat infection, of course, that you should not, problems of infection can be there. But it is not like that. Dystonia cannot be like that.
Okay. And how soon does dystonia go away, or does it comes back if you take it?
It can be managed, actually, if you really take care, unless it is not a very fatal disease. Okay, but if you can take care, you can manage. It will not continuously, it will not go away, but you can always manage it through Ayurveda if you're really interested to take care of yourself.
And Dr. Nair, also, let's have a final thought on about anything related to your eyesight or headache that can also affect this. Stress factor, shock factors, like we mentioned initially. These could
Stress is always a contributing factor for this, actually. See, headache you mentioned. Headache can be because of you have a blood pressure, maybe you have sinusitis, whether any related with your neck issues. So that we have to rule out.
Okay. So these are a couple of things that we spoke today about vocal cord dystonia, that is laryngeal dystonia. It can be taken care of when it is right time diagnosed and the treatment is followed as it is. And as Dr. Nair just mentioned, it is a very simple procedure of treatment where panchakarma and certain medications are given rest to your vocal cords, and you're back to singing, speaking, or even talking to your family members and friends. So any condition that you feel are very concerned about, every day new diseases, new symptoms are coming up with new variants of the COVID. Also, people are confused and overwhelmed with all this information. So do not hesitate to just have some home remedies or go through the natural healing processes through Ayurveda. And Dr. Nair and her entire team is available. You're vaccinated. You have your, negative test. And apart from that, they also do online consultation. Dr. Nair, your final words on this condition. And like we mentioned, these are capsule series, so we want to close this.
Yeah, do gargle every day. Even you can boil the tulsi, turmeric, you can always gargle with salt also. But, before sleeping, after your dinner, brush your teeth, do an oil pulling. You can see that no dystonia will catch you.
Okay. So when you mentioned tulsi, can we use tulsi powder or only tulsi leaves?
Tulsi leaves are very good. If you don't have anything, that is boil the tulsi powder. That's very good, actually.
Okay. So solutions are available everywhere around the corner, but if you get it from the right source so that you can keep your body.
Open your eyes. Open your eyes and see in the kitchen. Everything is there.
Everything there. Okay, so we have to start cooking again and taking care of ourselves. It's not always the outside, it's always the inside. And Ayurveda is about mind, body, and soul together connected in the right way. All the solutions are available. Thank you so much, Dr. Nair, for today's episode. Friends, please like, share, and subscribe. We are keeping the episodes absolutely short and sweet for you to get all the information in the first 15 minutes. I look forward to the next episode, Dr. Nair. Thank you.
Thank you so much, Madhavi.